It's time to focus on seniors with Helping Seniors TV. The television show designed to make you aware of senior issues and needs, as well as to acquaint you with the resources available to help you age in place and with dignity. Now, here's your host, Joe Steckler.
I'm Joe Steckler, and welcome to Helping Seniors, the television arm of Helping Seniors of Brevard County. Our show is designed to provide you with information on how to develop your own aging and care plans. Our topic today is the importance of dental diagnosis. Joining me is Dr. Lee Sheldon and Dr. Matt Sheldon of Solid Bite Dental Implants. And yes, they are father and son. Yes, you have to really see it to believe it. Welcome, Lee.
I'm the father, by the way.
You're the father.
Yes.
I know. And Matthew, we're not going to mistake you as the father.
By default, I'm the son, yes.
Did you used to have black hair like Matthew?
I did have black hair like Matthew.
But you're like
I had hair like Matthew.
You had hair like Matthew?
Yes, I did. It's been a while.
You know what? I think I'll be very smart and get off that subject and talk about diagnosis.
Good. Diagnosis not here. Diagnosis here?
Diagnosis here. Right here. Why? And I'll ask both of you. First, you, Lee. Why is diagnosis so important? You've been doing dentistry a long time compared to Matthew, but I'd like for your opinion on diagnosis, and then you, Matthew.
I think we're used to the idea as patients. I'm talking as a patient, going in and getting a filling done. Well, what's the diagnosis there? You've got tooth decay and you do a filling. When things become more complex and you start to develop other diseases besides just simple decay, and you start to have problems with tooth alignment, with gum disease, with missing teeth, then there's a lot of thinking that needs to be done before you make the final decision on how to reconstruct. Because once you're doing that reconstruction, that's a major event, a major investment, and we want to make sure it's planned right, just as we would want to make sure that a house is planned correctly. And that's where diagnosis comes in.
Matthew?
And to piggyback off that, a big buzzword the past few years is don't focus on single tooth dentistry, because if one tooth is failing, maybe you have to look at the whole system and see if other things are going wrong rather than just fix one thing. Plug a leaky faucet. There could be something wrong in the bigger picture.
Okay. Now, here's a layperson's take on what you two experts are saying. Many people, when you talk about a single tooth problem, if you have a tooth here that's bad, instead of maybe spending the necessary amount of money to correct that, a dentist may say, let's just extract it instead of spending all that money. The extraction of that tooth is not just simply pulling and putting it. You stand a chance of altering your whole bone structure. Your teeth move.
That's right.
And it affects the alignment up here.
That's right.
And that's what's so important. That's what many people don't think about. Of all the dental shows, Lee, that we've done over the years, and we've done a bunch of them. I've probably done more dental shows with you than any other panelist since I've done over 300 shows.
Thank you.
But
and I started late in your broadcast career.
Yeah, but not with the TV part. Yeah, you were right on the beginning of that. But we've talked about sleep apnea. We've talked about, what is it, TMJ?
TMJ, yeah.
TMJ. What is TMJ? We're talking about diagnosis. That's important.
TMJ is temporomandibular joint, which is a big word that says this area, this hinge joint where the lower jaw joins the skull. That TMJ is a syndrome which has to do with muscular inflammation, which causes headaches, and it has to do with bites. It has to do with the position of your neck, of your back. There's a whole lot to TMJ, but the bottom line is it affects jaw function, and it may affect the way you feel, because headaches and pain behind your eyes can be pretty severe, and it may be related to the position of this joint.
And we're talking about the importance of diagnosis. Right. And we didn't even put that in.
No, we didn't.
I asked him to send me a bunch of questions so I would get the right things today. But we could talk about this many things, and there's probably this many we have to discuss.
But the fact is, if a person has a TMJ problem and you're reconstructing the bite, you better know everything you can possibly do for the TMJ problem, because you may reconstruct the bite in an area in a way that you can reduce the inflammation up here. So it's important to know that in advance.
All goes back to diagnosis.
Yeah.
His is the older school of dentistry.
Oh,
Matthew.
get out of here. I'm not that old.
But as a younger dentist, I'm sure you know, you yourself have said that there are so many new innovations in the field of dentistry.
Yes.
Matthew's been exposed to those things. You probably have picked up on all of them, and there's something else I want to talk about. I'm sure we'll talk about it later. But in the area of diagnosis, with what I've said, what your dad has said, Matthew, as a younger dentist, how do you view the importance of diagnosis?
It really is stepping back and looking at the whole picture, not just diagnosis, the etiology, the cause of why the disease exists, and the prognosis of each one of your teeth. And so that all begins with a nice, thorough examination.
Okay. Can both of you give me some examples of how correct diagnosis can help save teeth, cause less pain, save money?
Sure. You think of yours while I give you mine. So let's take a single tooth.
Take a what?
A single tooth.
Okay.
One tooth. Okay, that single tooth has tooth decay. And that tooth decay, for whatever reason, has gone below the gum line and has gone into the nerve. What do we know? We know the decay has gone below the gum line, causing periodontal disease, just by virtue of the fact that the tooth is decayed. And the decay has gone into the nerve, causing the nerve to die. So we know that. If we've diagnosed that in advance, then we need to look at, all right, what different combinations of treatment should be done? Should the tooth be extracted because it's so badly diseased? Should the tooth be reconstructed? And if it is, how strong or how weak will that tooth be once we do all the reconstruction that might be necessary, which might be gum surgery, root canal, and crown? Or what's the condition of the bone around the tooth? And is that bone conducive to a dental implant? And will the dental implant be more predictable than saving the tooth? Those are all, if I'm looking at a tooth that's that badly damaged, those are all of the things that I'm going through in my mind as I'm looking, and then I need to be able to communicate those different options to the patient for the patient to make the appropriate decision for him or herself. Usually the patient will say, well, whatever you think. But at the same time, the patient needs to be involved and has to know what's going on. That's a simple diagnostic problem that we can look at.
But if you didn't do what you did, if there were 5 things that needed to be pointed out to the patient and you only pointed out 3 or 4, the one you fail to point out or the one you fail to look at could be the thing that changes the whole total picture.
Could be.
Yeah.
Could be. And that's what we do know. There's always that factor, what don't we know? Because, we're not 100% accurate in everything we do either.
That's why diagnosis is so important.
That's right. We at least need to know what the probabilities are, because the watchword here, and the reason that I think that people with complex diseases should be going to the periodontist first, because that's how we're trained. We're trained in terms of diagnosis and treatment planning. But the watchword is predictability. There are plenty of people, maybe you, maybe others, certainly others out there, where you're looking at me right now and you're saying, gee, what do we mean by diagnosis? Well, if we get treatment after treatment that fails, then we've got to look back and see what was it that we missed, or what was it that if we diagnosed correctly, we would have predictable dentistry and it would be right the first time.
So we're saying it's more than just filling a tooth.
Oh, much.
You can see the decay.
Yeah.
You can't see all the other things. You can't see the nerve damage.
It's true. You also can't see just by looking at the tooth. And maybe Matthew should get into this, because Matthew has developed reconstructive capabilities that somebody his age, there are very few people his age who either get the opportunity or have mastered what he's been able to do. And so we may talk about not just a single tooth, which is where I started, but what he specializes in, which is jaw relationships and getting things working correctly.
What is your example going to be, Matthew?
I was going to talk about the At first, the least expensive type of dentistry is preventive dentistry. So diagnosis, catching things early, modifying habits at home, if it's drinking a 2-liter of Mountain Dew a day, Dr. Pepper, smoking, a lot of factors with dry mouth.
I just did a show yesterday with a cardiac surgeon.
Yeah.
He talked about smoking and heart disease. What's the relationship with smoking and dentistry?
A lot of things. It can lead to dry mouth. It can also help out with give you
Smoking can lead to dry mouth.
The nicotine, yeah, right?
Yeah. You reduce the blood supply to the mouth. You reduce the salivary gland capability of producing saliva. When you have less saliva, the mouth becomes more acidic. If you have more acid in your mouth, more teeth decay.
You let him explain it now. You keep going.
Well, you looked at me.
What else? I kind of started to cut you off. What else were you going to say, Matthew?
And a lot of the medications out there that cause dry mouth, all the antis, the antihistamines, the antipsychotics, the antidepressants, cause dry mouth. Dry mouth leads to decay, and so you start losing your teeth. I
had an itch on my left arm, like an eruption. And I went to my primary care doctor, and they gave me salves and all these things. It wasn't working. I went to a dermatologist, and they did a biopsy. They said it was a medicine that I was taking was causing it. I was having an allergic reaction to a medicine. So they told me to stop 2 medicines. I only heard them tell me 1. So when I went back a month and a half later, they said, well, we told you. I said, you didn't tell me stop that one. Well, I want you to stop it. So I did. Didn't change anything. We stopped another medicine. That didn't change anything. We changed another medicine. The problem, I think, is going away. Yeah, it's in the field of medicine, there's still trial and error. There could be maybe 5 drugs that cause something, but those 5 drugs don't act the same way in everyone's body.
That's right. But there are 500 drugs that cause dry mouth.
Wow.
So if you're on multiple medications, even if you're on single medications, chances are good that you've changed the characteristics of your saliva, and not for the better, but for the worse, making you more prone to dental disease.
Unbelievable.
Yeah.
It really is.
But we also have the bite relationship problem because, we grow accustomed to the way our teeth look and the way our teeth function. And sometimes those teeth don't really meet very well. But if we get to the point where the disease becomes more advanced and we have to start extracting teeth and replacing teeth, it's much more difficult to replace teeth in a poor bite condition and get replacement teeth meeting unevenly, if you will, than it is, to create a bite that's comfortable for the patient. So that we're starting to replace some teeth. And let's assume you're missing a couple of lower teeth down here, right, and we're replacing them with a bridge or with dental implants or whatever we're doing. If the upper teeth came down over the years and we're trying to replace the lower teeth to accommodate the teeth that are now like this on the upper, then we end up creating a problem that may be worse for the patient.
The bite problem.
That's right. And so we want to do something about the uneven bite on the upper and smooth that off so that whatever we put in on the lower that's opposing that is going to function properly.
Is that why every time you and I do a show and we talk about this, I sit here and I sort of push my lower jaw against this up here?
Stop doing that. Those are my implants you're pushing against.
Well, I always felt, is my bite right? Yeah. And it's something I think about. Every time I talk to you about teeth, I wonder about myself. Have I done the correct thing with my dental work? And I guess you don't want to become overly conscious of it.
No, you don't. It actually has a name. It's called dental awareness. There is such a thing. Yeah, where people start doing this.
I know. I do that.
Yeah.
I grit my teeth. What do you do if you do grit your teeth?
Stop it. When it comes right down to it, and seriously now, there are a number of people who grit their teeth, grind their teeth. Maybe up to 70% of us do this at one time or another. And usually when we're gritting our teeth, it's at night when you don't think about it rather than during the day. You can see it if you look in your mouth, if you look in the mirror. You just go like this. And you take a look in the mirror, and if your lower teeth meet your upper teeth evenly, then you're doing this at night. The canine teeth, which is the third tooth back, wherever you're looking at it, the upper right, upper left, lower right, lower left, is supposed to be a pointed tooth. If that tooth isn't pointed, by the way, it grew in pointed. When you were 11 years old, it grew in pointed.
Is yours pointed? No? Is it, Matthew? Third tooth is not.
Yeah, but mine are veneers, so so I can design them out, but they're not flat. But if your canine teeth are flat, then it means you're grinding against those canine teeth, and you're taking that point and you're gradually flattening it. That means you're doing an awful lot of damage yourself at night. So one of the cheapest ways of taking care of that problem is to have your dentist make you a night guard, a hard plastic appliance where the dentist can help you direct your bite forces correctly.
You told me to do that. I do it.
Good.
Yeah.
Thank you.
Right? At least I do try to follow advice. But folks, I have to tell you, every time I have Lee on the show, I watch him demonstrate. He uses his hands, his face. He's not afraid to show you what his mouth looks like. And he actually must go to a pretty good dentist because he has very beautiful teeth.
Thank you.
And did you have the whitening done?
I actually have veneers placed by Dr. Jennifer Chase. And this
say that again?
I had veneers placed, and that was by Dr. Jennifer Chase, and that was, about 2.5 years ago? 2.5 years ago, yeah. If you take a look at the old shows, I have spaces between my teeth.
I'll have to take a look and see.
Please do.
But what are some of the new testing? Both of you, we've talked about various devices, but what are some of the latest in diagnostic devices that we have to use to do what we're talking about?
Actually, you're speaking of your dental awareness. There's a few good diagnostic tests for that to see if your bite's correct. One of them is called a T-scan. We put a computerized wafer, a computer chip, in your mouth. It looks like a horseshoe wafer, and you bite on it. And it tells you the forces you're putting on each individual tooth in a percentage.
Is that kind of like putting a piece of foil in there and you're tapping your teeth?
Like that, yeah, exactly. But it spits out the numbers on the computer screen and tells you exactly the percentage of force. You're supposed to have about 10 to 13% on a tooth in the back, about 5 to 7% on the front teeth, and it'll tell you if you're biting too hard on the front teeth or back teeth. Okay.
We've established that there are 3 of the cameras that go down below the gum in the state of Florida. How many dentists have things like you're talking about right now?
T-scan, I know we've got, I know that there's at least one other in Brevard County, and probably more than that.
Yeah, it's growing in popularity. It's relatively new.
But the reason it's growing in popularity is very obvious. It's more precise.
Yeah.
It takes the doubt out. Because as much as the dentist puts that stuff in my mouth and tells me to tap, I'm not sure if I've tapped the same way all the time.
That's right.
So you can't tell. What other things do we have? That's something people need to know about that.
Exactly. One of the simplest things we do during a routine examination is a pH test, where we have the patient put a litmus paper, like in science class, in your mouth, and it tells you how acidic your mouth is.
Why is that important, Matthew?
If the number is below 5.5, you've got the scale from 0 to 14. If it's below 5.5, your mouth is in a constant acidic environment, which that means your teeth are demineralizing faster than they're remineralizing, causing cavities, dental disease quicker.
Would that be a test more conducive to younger people than it would be to older people, or not?
Anybody that has teeth in their mouth, it's a good test for.
So no matter how old you are or how young you are, you can still have these forces adversely affecting you.
Absolutely. Yes.
If you determine a person has an acidic level below what it should be, what can you do to help bring that acidic level back up to within normal tolerances?
There's prescription products we recommend. There's also simple things like baking soda rinses to drive the pH back up. Yeah.
Wow.
And lay off the acidic foods that are causing it also.
I would say
lay off the acidic foods, the sodas, the things that are causing that, whatever the cause is to begin with. We can talk about diet modification.
I gave up Cokes for Lent.
Ah,
I gave up cookies for Lent. My
good.
daughter is
Let's make sure that Lent is lasting 365 days this year.
You're just like my daughter, who is a nurse and says the same thing. She's the one that sells the Juice Plus.
Good for her. And
Yeah,
by the
she's
way, I'll
at-
be speaking at a Juice Plus meeting next week. But this
You are?
This show is going to show well beyond that, so it doesn't make any difference.
Your specialty is dental implants. But are you picking up?
I'm a periodontist. I beg your pardon. I happen to do dental implants, and I do more dental implants than most people. But you're right.
Okay.
I'm a periodontist.
But where do implants fit? And we're talking about the importance of diagnosis. Why? I think during a break between shows, you were talking about if the upper and lower jaw, if your bite is not right, or if you have something messed up down here, and if you don't fix what's up here, the bottom part's not going to work right.
That's right. Yeah.
Is that where implants come in?
Not necessarily. I'd say dental implants is more of the treatment modality rather than diagnosis. I think when I'm looking diagnostically, I'm saying what's going to put the patient at the least risk and get the best result. So, for example, I can put bone grafts any place in the mouth and get bone to grow so we can put dental implants in. The sinus is often very prominent here, and the sinus is an airspace. Sometimes there isn't enough room for a dental implant. I can do a sinus lift, create enough bone below the sinus, and put a dental implant in. But that's an invasive procedure. If I see that there are two teeth on either side of the sinus where we could put in a bridge and not do dental implants, then we may choose to do a bridge rather than do the dental implant because it's easier on the patient and it'll take less time for the patient to get that done. So again, even though I'm a dental implant guy, as you said, there are other treatments that may be better than dental implants depending on the situation that the patient has.
And all the show that I have never doubted that you would tell the person that you were looking at their mouth when you diagnosed them whether it would be better to have an implant or whether it would be better to, because in my case, you said implants here.
Yeah.
Here you talked about building the one small tooth, hook it over the other one. I just removed a crown I had and put something in place. By the way, it's worked. That's worked wonderfully too.
Glad. That's good.
So I think it's extremely important.
But the thing is, we get hung up, and you see me because I advertise dental implants. It's why do you advertise it? Because it's a buzzword, and people want to see, and they want to know, and they want to, of course, go to a person who knows something about dental implants, of course.
Right.
But people are so focused in on the treatment. They're focusing on the treatment, and frankly, at my dental implant lectures, and certainly among periodontists, because I run a national organization for periodontists. What we're trying to promote and promote to people is not the treatment modality, even though there's romance in that. It's thinking about the entire case first in order to design things correctly for predictability, and that's where diagnosis and treatment planning are very, very important.
It also points down to the importance of making a decision whether to try to repair a tooth or extract a tooth.
Of course.
Why is that so important, and how does the importance of diagnosis affect us? Because every time we take something out of our body or out of our mouth, we run a risk.
It's true.
So how do you make the decision to whether or not to extract? And what are some of the things that our viewers should be thinking about when they go to their dentist and ask them questions about what we're talking about?
I think a lot of it is talking with the patient. When a patient comes into our office for a new patient visit, they're spending 2 hours with us. Now, it's not all with me, and it's not all with Matthew, but they're spending 2 hours with us. Of course, the types of patients we see are patients who are complex, usually aren't just making a decision about one single tooth. They're making a decision upon how they're going to look, how they're going to chew, and it's more of an overall decision. I've got to be able to communicate, whether it's me or through my staff. We need to be able to communicate with the patient and give the patient enough to think about and enough information that the patient can make the correct decision for him or herself. We're looking, no matter what they're going to be investing in, it's going to be a considerable sum of money, no matter what it is. It's much better to invest that sum of money and know that, in fact, you're going to get a predictable result than to invest that sum of money and then say, 2 years later, oh, what happened here, and then get
I should have done something else.
Yeah.
That's not
and,
good.
And this is not to say anything negative about the profession, because the profession of dentistry in this country is probably better than any other area in the world. But we do tend to get hung up on treatment, when both from a patient perspective as well as from a doctor perspective, and particularly the doctor perspective, the doctors want to be able to take the time with the patient to diagnose things correctly and not necessarily rush right into treatment. If you have a toothache, you've got to rush into treatment. But if you're looking at replacing teeth, and you're looking at it from a cosmetic, or you're looking from a functional standpoint, you want to get rid of partial dentures, and you want to make sure that things are meeting correctly, frankly, that takes a little bit of thinking. When Matthew is doing that kind of thinking, it isn't necessarily looking in the mouth. It's making impressions of the teeth, pouring up models of the teeth, mounting them on a jaw simulating device, changing the bite relationship on that jaw simulating device to see what would happen if we did this, what would happen if we did this, what would happen if we did this. Correlate that with the CT scan and with a life-size model of what the teeth of what the jaw looks or what the jaw is. Fitting in dental implants, perhaps, and perhaps not, to see how they would line up with the opposite teeth. Those are the things that we need to do before I ever start drilling a hole in somebody's mouth. I apologize for saying it that way.
No, but you have just successfully managed me to end our show on time. And I want to thank you. I want to thank you, Matthew, for being here today, because I think our viewers learn a lot from what we say. And I want to thank you for watching today's show, people. It's been great.